Alberta Health Services. Healthy Albertans, healthy communities, together.
Good morning, everyone. I'm David Wyant, Chair of the Alberta Health Services Board, and I would like to welcome you to this AHS Public Board meeting. Thank you for taking the time to join us. In my brief introductory comments, I would like to thank, as always, our frontline staff and other health professionals for their outstanding work in helping to prevent the spread of the novel coronavirus. I would also like to thank Albertans who comply with the mask wearing and physical distancing recommendations, and to thank public transit workers, retail staff, and others who assist in reducing the spread by reminding us of the beneficial practices that enable us to move forward with the relaunch without increasing the risk to ourselves or others. Now on to the business of the meeting. We will be participating by telephone conference today. When I ask for a vote on a motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none who oppose or abstain, or if there is a majority who do not, I will declare the motion carried. May I ask that someone move approval of the agenda that was circulated for today?
Hugh.
Thank you, Hugh. And the seconder?
Heidi.
Thank you, Heidi. Anyone opposed or abstaining? Thank you. The motion is carried. The agenda is approved. Based on the approved agenda, do any board members have a conflict of interest they would like to declare at this time? Hearing none, we will move on to the motions recommended by our board's Finance Committee. I would ask David Carpenter, as chair of the Finance Committee, to present the committee report on motions.
Thank you, Mr. Chair. The Finance Committee met on August the 5th, 2020. The committee considered an item for recommendation with respect to the setting of the preferred accommodation rates. The board is to approve preferred accommodation charges pursuant to the Hospitalization Benefits Regulation. On July 1st, 2017, the board delegated authority to the AHS President and CEO to annually approve the adjusted preferred accommodation rates based on the change in the Alberta Consumer Price Index. The AHS review conducted by Ernst & Young in 2019-2020 and subsequent discussions between AHS and EY led to the recommendation that preferred accommodation rates be increased based on jurisdictional comparators. Management presented the analysis to the committee along with the recommendation for increases in the preferred accommodation rates. The committee recommended the board approve such increases. The board has also reviewed such increases and supports the same. Accordingly, I move that the Alberta Health Services Board, 1, revoke the June 1st, 2017 delegation to the AHS President and CEO of the authority to annually approve the adjusted preferred accommodation rates based on the change in the Alberta Consumer Price Index, and 2, approve in accordance with the Hospitalization Benefits Regulation the increases in preferred accommodation rates recommended by the Finance Committee and reviewed by the board to address a recommendation from the AHS review conducted by Ernst & Young for the Government of Alberta. I so move.
Thank you, David. Do we have a seconder for that motion?
It's Brenda. I second.
Thank you. Any further discussion? Any opposed or abstaining from the motion? The motion is carried. And David, the Finance Committee's second motion?
The committee also considered an extension of the agreement between AHS and Dell Canada Inc., Insight Canada Inc., to provide for end-user devices for 1 additional year from August the 18th, 2020 to August 17th, 2021. The committee was asked to recommend board approval of the extension and of the delegation authority to the AHS President and CEO in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. The committee considered the terms and conditions of the extension and recommend board approval of the same. The board reviewed and supports the same. Accordingly, I move that the Alberta Health Services Board approve, firstly, the extension of the Dell Canada Inc., Insight Canada Inc. agreement dated August 2014 for end-user devices for a term of 1 year from August 18th, 2020 to August 17th, 2021 on the terms and conditions recommended by the Finance Committee and reviewed by the Board. And secondly, delegate the authority to the President and CEO to execute documents on behalf of AHS to effect the extension in accordance with Policy 1100, delegation of authority and establishment of controls for commitments. I so move.
Thank you, David. Will someone second the motion?
Brian?
Thank you, Brian. Any further discussion? Are there any opposed or abstaining from the motion? The motion is carried. We have reached the end of our agenda. I declare that the business meeting is adjourned. Thank you to everyone for joining us, and stay well, be healthy.
Together, we do amazing things every day.